Us on health and wellness. My name is Zaitun Ali, and on today's episode we want to discuss about World Oral Health Day. So that was marked on the 28th of March, and the theme is a happy mouth, a happy mind. So joining me in studio, I have Dr. Liz Bibo, who is National Treasurer, Kenya Dental Association. Welcome to the show.
Thank you for having me, Zaitun. It's really nice being here.
I was asking her, are you normally this soft-spoken? Because on this other end, someone is shouting. On the other end, someone is very calm. And you said your profession actually requires that.
Yes, it's really important to ensure your patients are calm and comfortable.
Yes.
Because, you know, dental treatment is very stress-inducing. So if you're able to take it down a notch by, you know, just the ambience, the way we talk,
yes,
we always try to do that.
Hey, where do you practice? Kenya Dental Association, what do you guys do exactly?
Okay, so Kenya Dental Association is the premier association that advocates for welfare of dentists in the country. So we also advocate for oral health in the nation. And beyond that, we try educate the public on the need of oral health. We also go out and champion for it. Particularly during this season, we've had a number of oral health outreach programs where we've gone to areas where people cannot easily access oral health and worked with the community to give them the much needed services. Okay. Yes, so throughout, I think the past 2 weeks, we've had campaigns around Nairobi County. We had a big outreach in Narok County at the All Malaika Trust over the past 3 days. We marked the day in Makueni County with a very big activity in collaboration with our partners from the Ministry of Health and the Kenya Armed Forces. So we're really happy that oral health is now getting a bit more visibility and people are getting interested on taking care of their mouths.
Okay, that makes sense. So when we're talking about oral health and in connection to the theme of this year, so how do we now connect oral health to mental wellness? So a happy mouth is a happy mind. How do you do? What's the scientific connection to that?
So it's the mouth is in a lot of ways the first thing we see. They say the best thing you can wear is your smile. And if you're not confident in your smile, you also not be confident in a lot of things you're doing. So when we talk about a happy mouth is a happy mind, we want you to be confident in your mouth in terms of how it looks, in how it functions, meaning it doesn't have pain, you don't have missing teeth, and just overall being able to walk out and even the way we are conversing, there's a little factor we at times don't talk about, that is bad breath. You know, it can make you very antisocial, which again is also a form of bad mental wellness.
Okay.
So we encourage you to come visit your dentist so that we make sure you're as confident as can be in your smile. And when you have this added confidence, you're able to walk out, you're able to interact, you're able to pursue your passions and your purpose in life in confidence.
Oh, wow. That really makes sense. And you've mentioned a few of oral hygiene, let's say that, and oral issues. So as you guys were doing the outreaches, what are the common oral health issues that people were coming across with?
Yeah, so unfortunately the biggest thing that brings people to the dentist is pain.
Okay.
And we want to change that. We want you to come visit us even when there's no pain.
How often should we visit a dentist for checkup?
We recommend every 6 months, and at least, at the very least, if you can't make it every 6 months, come in once a year. So the reason is we want to make sure we can professionally clean your teeth to reduce the amount of time bacteria has to work on your mouth and damage your gums and your teeth. So if we're able to limit this to 6 months, or at the very least 1 year, we're able to control this. One of the key things about oral health is most of the diseases are highly preventable. And when you go out to the public, we're just not treating the conditions we have. We're also empowering you with the knowledge on how to properly take care of your teeth. So this is brushing your teeth twice a day. And of course, the technique of brushing your teeth is also very important. We also talk about flossing your teeth. At times we brush our teeth and we forget that in between your teeth you need to brush your teeth. We talk about your diet, having a diet that you're not consuming a lot of foods that can cause cavities.
Okay.
These are, we call them cariogenic. So these are our biscuits, our cakes, our sodas. Limiting that is very important. So circling back to your question, what are the common diseases we see? Of course, top of the list is cavities.
Yes.
Those are holes in your teeth, and we see them in varying degrees. We can see very small cavities to medium-sized cavities to very big cavities, and at times we just find roots that are left after the whole tooth surface has been worn out. So beyond that, we see gum disease. And a big hallmark of gum disease is bleeding when brushing or very red gums. And of course, accumulation of plaque and calculus in your mouth. So when we go out to the field, the Kenya Dental Association has a caravan with mobile units that enables us to treat these conditions in the field.
I'm very curious, because what actually led you to do dentistry? Really? What inspired?
So very funny story. When I was in Form 4, I had a conversation with my brother, and I was torn between medicine and engineering. And he told me,
your brother, the one we were talking about?
Yes.
Mark Bichachi. Shout out to you. Actually,
Hi, Mark.
amefikisha salamu.
Yeah.
Okay.
So he told me something that, of course, Mark is a bit off the books.
Yes.
So he told me, do you like talking to people or to machines? And that really got my cogs, rolling. I wasn't sure whether I'm more introverted or extroverted.
You look like an introvert.
A bit of an ambivert.
Okay.
Yeah. So when I was going into my Form 4, I always said, if I do medicine, I'm immediately specializing into surgery so that I can play with the machines and tools. And as luck or fate had it, someone whispered in my ear about dentistry, and the rest is history, as they say.
Oh, really?
Yes.
But it gives fulfillment.
100%.
Nice.
I enjoy how you can change someone's day with just one action, and that a lot of times is how dentistry is. You'll come in with severe pain, you see us, and you leave comfortable. So the change that you can see in a person's demeanor, in a person's personality, their well-being, especially when it comes now beyond the pain, cosmetic treatment, when you are able to align your teeth or brighten your smile, you actually a different person walks in and a totally different person walks out. Okay,
that makes sense. By the way, I'm very guilty, because I can't remember the last time I stepped into a dentist's office or a dental hospital. Ni mtajitaji ni hospitali tu bado.
Yes.
Okay, sawa. I can't even remember the last time. I've never had to do the cavities, nothing. Okay. So I'm one of the people who we come to you when we feel the pain. So we are here to know actually the basics of oral hygiene. Yeah. So just what can we do to stay away from the dentist?
So now, Zaitun, you've gotten yourself a personal dentist.
Now, literally, one who's calm and collected.
Please, let me see you next week. We book an appointment.
I'll make a point.
Yes.
I will.
So the purpose of the visit is because even though you're brushing your teeth properly, there are areas your toothbrush is not able to reach. And that's where the dentist comes in to help you reach those hard to reach areas and clean them properly. So this is one of the key treatments we offer on those routine treatments, the cleaning. Beyond that, cavities start to form, and in the initial stages, you don't feel the pain. So it's important you visit your dentist so that we can identify these areas. So for two reasons. Number one, if you come in really early, we'll be able to change the factor that is causing you to have a cavity. So let's say, for example, you have a sweet tooth, we'll be able to talk about it and see how we will either limit the number of chocolates you take or increase your visits so that we make sure your teeth remain as healthy as possible. Number two is when we have these small cavities, the earlier we get them, the more easier it is on your pockets. And I know you alluded to this when you're talking about affordability. And the unfortunate bit with it is the longer it takes for you to see the dentist, the more you will have to, of course, pay for treatment. So if you're looking at small cavities, they're often more affordable to treat than more complex procedures when we're talking about root canal treatments, or when we've removed the tooth and we're replacing it and we're talking about implants. So again, I see you have your son here, which is really great.
Yes, I have my son here. And that actually was the next question about our children's oral health.
Yeah, so it's important for you to come to the clinic as parents so that we can educate you on oral health and oral wellness. So if I'm able to educate you on how to take care of your mouth in terms of brushing your teeth twice a day, flossing, cleansing your tongue, you're able to pass down and reinforce this information to your children. Yes, and then now for children, again, we also encourage them to come visit the dentist as early as 6 months when the first teeth come in, so that we can also reinforce this in you. So when we're weaning them, we know, or we've heard that you should put some sugar in the water that they're taking or in the milk. This is not necessary. But this information, you'll not get it if you don't come to the dentist. So it's important you come to the dentist and you maintain this routine. The other reason that it's important for parents to also bring their children is we have one way or another gotten phobia of visiting a dentist.
Very true.
And at times it's not directly from what happened to you, but what you've had. So especially from a young age, if we create a good friendship with your son, they'll know, oh, I'm just going to see Dr. Liz. It's nothing serious. But in that visit, I'm able to monitor to make sure he's not developing any cavities, to make sure his teeth are clean, he's brushing properly, and where we need to reinforce, we can have that conversation.
I'm not sure if I'm the only parent who has a nightmare when it comes to removing the teeth. He's at the age, he's 6 years right now, and he's removed, I think, around 6 teeth. 6 actually. And it is a hell removing them. So that's the only thing I actually was almost coming to the dentist to do. To the removal of teeth. So you can just let us know how to best take care of that when they start shaking. How do we properly remove it? Nimeanza hapa consultation mapema.
I will send you my invoice after this. So, I will be honest, I'm also a mom and a dentist, but the irony is when it comes to removing my son's teeth, I also struggle. So I think it's a mom thing. You don't want to hurt your child.
I know.
The funny thing, it's not traumatic. So what I encourage parents is make it fun. Make whole experience out of it, especially the first one that comes out. I know some parents shy away from the tooth fairy tale, but it is good. It is an incentive kind of that they know, oh, if I remove my tooth, at least something nice will come out of it. Because you see, you've done 6 teeth.
Yes.
You have 14 more to go. So you need
14.
Yes. So
That's
you need that momentum going, you need that excitement going. So especially when a parent comes to me when they're removing the first tooth, I encourage them to try make a big deal out of it. You know, definitely visiting your dentist will help. When you're in doubt, whenever you're in doubt, our doors are always open. Come visit your dentist, who will help you. The other thing is, of course, we don't want to remove teeth too early because also that poses a challenge in the future. So visit your dentist, and actually that is why the yearly visit from a young age is important, because as you enter this milestone of shedding teeth, we'll be able to walk with you and guide you through the process.
Okay, that makes sense. Asante sana. So when we are talking about the basics, like I asked, so brushing your teeth, how long, how many times a day should you do it? For how long? Could you just lay the foundation of the basis for oral health, hygiene, that we can do even at home for both kids and even adults?
Perfect.
Yeah.
So, of course, you need your instruments, your toothbrush, and your toothpaste. For children, we recommend formulations that are specifically made for children, because the fluoride levels in the toothpaste for adults is a bit higher. So all you need for a child is about less than a pea-sized amount, very small amount to help them cleanse their teeth. So how do we brush our teeth? So we recommend you brush your teeth using a semicircular motion, following the contour of the gum. So the gum is very delicate, and when you brush too hard, you'll end up damaging the gum. So if you brush horizontally, you'll end up cutting the gum across and damaging it. If you brush too much vertically, you'll end up pushing the gum up, which is also not right. So we encourage you to brush in a semicircular motion with the brush slightly tilted towards the gum. 2 to 3 teeth at a time, and you go all the way the outer surface. You brush the inner surface, and then you finish with the surface that bites. And then now you repeat the same thing on the lower side for at least 3 minutes.
You're brushing your teeth for 3 minutes?
Yes.
As we do just one, sini raka 3 minutes?
Yes, for 3 minutes.
You're hearing? Yes.
So now we have very nice devices that can help you with that. We have nice timers that you can purchase, which has, the hour clock. So it's just 3 minutes. So it can tell you once the 3 minutes is up, then you can finish rinsing your mouth. And then, of course, after brushing, you remember to floss, and you can use your mouthwash. Or mouthwash also. You use it after you've brushed? Yes.
Or you can't use it before?
No, because it is to help rinse, and most mouthwashes have active ingredients like fluoride. So the fluoride in the mouthwash, we want it to stay in your mouth for as long as possible to help in the remineralization of the teeth.
And again, too much fluoride is also not good for the teeth.
Yes, so let me break that down.
Kindly.
So I think there's a saying that says too much of anything is bad. So even water is bad. So I don't want people to be scared of fluoride. So in our toothpastes and mouthwashes, we have a recommended amount, which is what is in this toothpaste. So this recommended amount will help strengthen your teeth in the long run. However, now I think we're looking at, when we talk about excess fluoride, we're looking at conditions such as dental fluorosis.
That's it.
So this is where you have excess fluoride ions in mostly your water that you ingest, mainly when you're a child, and this affects the development of the teeth. So this can come in varying degrees, of course, depending on the fluoride levels. So when you have very severe dental fluorosis, that's when we see the enamel really badly damaged and we see the brown discoloration. However, when the fluoride levels are not too much, you just see mild discoloration on the teeth that at times is hardly noticeable.
So coming to do teeth whitening is advisable at that stage?
So teeth whitening is also a very big field on its own.
I know. Oral health is, it's a lot. This is a whole series that we can talk about.
It is. So when it comes to improving the aesthetics of your teeth, we recommend you visit a qualified dentist. Okay, because some things don't work. For example, when you're talking about bleaching, it would not work on severe dental fluorosis. So that's why you need a specialist who will be able to give you the correct diagnosis and prescribe the correct treatment plan. Otherwise, you'll end up damaging your teeth without getting the desired outcome. So as I said, when in doubt, visit your dentist. So come to us, just have a conversation with us. Right now we have some very nice advanced tools. We're looking at digital scanners that can help create your ideal smile with Smile Design AI. So where we'll just get your smile after we've gotten the diagnosis and treatment plan, and we can just arrange your ideal smile, or we can envision how your ideal smile would look like and give that to you. So treatment from a dentist is often evidence-based. So that is why it's re-emphasizing visit your dentist so that we can clearly diagnose and clearly prescribe the treatment that will benefit you the most.
Okay, and I know right now AI, as you're using it, gives targeted solutions. So how has it been with these advancements in the oral health, especially the AI and all the others that you can mention about?
Yeah, so for us, dentistry is still very hands-on. And in as much as we can use AI to help chart out a treatment plan or give you a before and after treatment in terms of diagnosis or the treatment plan, we still have to physically do the work. So AI is a good tool, especially when you're looking at education and when we're prescribing treatment that is not, you cannot visualize in the moment. So I'll give you an example. If we're looking at the correct shade for your teeth, it's almost the same way when we're looking at the correct hair color or hairstyle that we look.
Complexion.
Yes, exactly. So with AI now, you can, put your picture and then you have different hairstyles that will overlay on your picture, and then you can tell how you look unlike before, where you'll go to the salon and then we are all shocked. So with AI, we can see, we're like, okay, what can we do if we give her very white teeth? How will she look? If we close her gap, how will she look?
You can even close this gap?
Yes.
Oh, literally?
Yeah.
Nani anataka kuclose na mimi natupatianga smile supu?
I was slightly shocked that you were asking about that because your gap looks really lovely.
Thank you. No, never closing this.
Really, really beautiful. So if you want longer teeth, how would it look? So that is how AI comes into play. So when we're talking about smile design, that's the whole concept behind that. Oral health is, of course, a bit green in terms, same as the medical field in terms of AI advancement. I think we've seen it more in technology. And as such, we need a bit more people to look into how AI can partner further with the oral health space. I believe we have had some people try telehealth, telemedicine, but for us, if your third molar is aching, I have to see it.
Actually, I'm calling you, Daktari. You can't. for you, you can't.
Correct. So there's a lot of advancement that is to be done within the oral health space.
Okay, but probably you can. I'll try one time to call you. So I'm here trying to remove these teeth. What do I do? Can I video call you? We'll see. We'll try and test. It starts with us. We want to take a short commercial break. Please interact with us on our WhatsApp line 0759434389. Social media at KTN Home. Let us know what you think about this topic, whatever problems, common health, oral health problems that you've undergone. Leo tuko na free consultation hapa na daktari as we mark the World Oral Health Day, brought to you by Sensodyne. So don't touch that dial. We're coming back shortly.
You are watching Health and Wellness.
Welcome back. If you're just joining us, remember this is Health and Wellness, and my name is Zaitun Ali. Find us on our WhatsApp line at 0759434389 and on our social media platforms at KTN. And the topic of discussion has been, as we're marking World Oral Health Day, this episode is brought to you by Sensodyne. And we were talking here with Dr. Liz about oral hygiene. What? Oral hygiene. Ini ngumu kidogo. Musinipatie maneno kama haya mawili yakifuatana. Oral hygiene. But we can also call it dental hygiene.
Yes.
It's the same thing. Karibu sana. I'm still glad to have you on the show. And we've talked about the basis of what we need to do to keep our oral hygiene in check. How long we're supposed to visit. Not how long. How often are we supposed to visit the dentist? We've been told 6 months. Ikienda sana, unaweza chapa 1 year. You can come visit the dentist 1 year. Na tumefanya mpaka appointment hapa na yeye, because the last time I am guilty of not visiting the dentist. We have done an appointment. Na usijaribu kupata makosa kwa sababu nimeishi hizi miaka zote bila makosa. Kwa meno usipate makosa. But I'll come. Yeah. So, what can you say about when it comes to habits? What 3 habits would you recommend when it comes to good dental hygiene?
Yeah.
Yes.
So, allow me to digress a bit from jumping off something you just said.
Oh, nice.
And you mentioned nisijaribu kupata makosa.
Exactly.
So, and I know that's something a lot of people are scared of. You'll say, no, but I go to the dentist, they'll see 1, 2, 3, 4, 5 things. And what I'd like people to realize is your mouth has 32 teeth and they're in the same environment.
Okay.
So a lot of times when you have a toothache on one tooth, there's a possibility that there's another tooth that is just lying there experiencing the same environment.
For real?
Yes. So this is probably to encourage the public that it is good to know where you stand. Let's get the baseline first.
Yes.
So if we say there are no cavities, let me give you the core check and say, yes, you're doing very well. Let's continue as it is. However, if you find cavities, it's important, of course, you also allow us address it, because remember what I said, if we don't address it when it is small, when it gets bigger, it gets more complicated, more expensive, and we won't want that. So when it comes to the at least 3 daily habits that you believe would that I believe would be beneficial, number 1 is diet. Your diet is very important. Ensure we're not having as I mentioned, ketogenic diet, which are diet full of processed sugars. That's biscuits, cakes, sodas. We rule that out completely. Number 2 is brushing your teeth twice a day for 3 minutes. And I think I forgot to mention, we're brushing after our meals.
After meals.
Yes, not before our meals. Yeah. And then number 3 is flossing. We often forget this. It's really important to clean in between your teeth. Most of the time, that's where cavities start to form. And I think probably the most important would be to visit your dentist. As I mentioned, it's good to know your baseline. Let's know where you are. Let's be able to address the issues. And when we started, I mentioned oral health diseases are highly preventable. So meaning if we're brushing, we're eating properly, we're visiting our dentist, we can be able to keep all these diseases at bay.
Okay, and actually those three habits will guide this second part of the show, because one, we've not talked about what's it called, our the food that we eat, our diet. What would you recommend, and what type of food should we be mindful of, apart from the sodas, nini food kawaida? What should we be mindful of?
So, of course, it's important to have a balanced diet.
Yes.
Your protein, carbohydrates, and vegetables, of course, are really important to hydrate. So this, we have no qualms, no questions about it. What we worry about are the processed sugars.
Okay.
Now, these still come back to our cakes, our sweets, our chocolates. Yes. So, I know, especially as adults, it's a bit hard to change our habits. And of course, our habits will end up teaching the next generation. So what I recommend is decreasing the frequency, especially in your household. So if, of course, you cannot go completely sugar-free, you can have a bi-monthly, that's once in every 2 weeks, you allow your family a treat. So that way, especially for children, they're not sneaking in sweets and chocolates and eating behind mommy's back. They know it's fine. Every 2 weeks, mommy will allow me a small treat. So if we reduce the frequency, then we are also reducing the likelihood of you developing cavities. Okay, so the other option is, of course, completely limiting it, which being real is a bit difficult. You limit it in your household,
then
but
in school,
correct, or the neighbor's party, or a get together. So the key thing is also educating your children, letting them know that yes, candy is not good, chocolates are not good, and if you must eat, tell me. So that is a good way where your child, even though they go to school and it's someone's birthday party, that they know, no, mommy does not like this, let me go home and ask mom. And then now, instead of them having 10 sweets at once, you can also regulate so that you are mindful of what they're taking. Okay,
actually, yesterday was my son's birthday, and there are those people who brought him gifts, sweets. Ziko mingi. Na tunaona tu wenye mlileta sweets. So what we're going to do, actually, we are going to moderate. Probably just give him kidogo. Yes.
So what I do with my son is, and unfortunately he's listening.
Yes, they're both here. Good day to be in studio.
So day one, his sweets will be there, and day two, they will just vanish from existence. So you see, when you don't see it, you don't want it, So since his birthday was yesterday, today we can still enjoy a little bit, but tomorrow they can vanish. Tafadhali.
Well noted. And now the second habit that you mentioned was brushing our teeth.
Yes.
So what technique can we use to choose the best toothpaste and even toothbrush? Because I have a question here. As you're answering that, we have questions also coming through. We'll talk about them. Yeah.
So the best toothbrush would be a soft bristled toothbrush. A lot of times we're not able to regulate how hard we're brushing our teeth, especially when we're not having this one-on-one conversation. So if you're using a soft to medium bristle toothbrush, you'll be able to cleanse without necessarily damaging the gums. We keep on going back to damaging the gums because the parts of the tooth that are not meant to be exposed. So the top part of the tooth protects the inner aspects, that's the dentine, the middle layer, and the innermost layer where we have the nerves and blood vessels from the external environment. So that's the enamel, the outside part. And then where below the gum, we have the bone and the gum that protects the root. Okay? So when we damage the tooth, either when you have a cavity and the inner areas are exposed, that's when you have pain. And often this pain actually starts as sensitivity when you have those small cavities. Now when you damage the gum is pushed a bit up and the root is exposed. The inner layer that causes the sensitivity is also exposed, and now you end up having sensitivity on your teeth.
That's how it comes about.
Yes.
Okay.
So we're very keen on the technique. And also, despite you brushing with the circular motion, we want you to be gentle. Don't be too rough. Remember, we're brushing for 3 minutes, so it's not just 1 minute chop chop and we're done. So let's be mindful of that. Just protect your gum and be gentle with your gum. And when it comes to toothpaste, we recommend fluoridated toothpaste because remember, the bacteria destroy your teeth with acid, and the fluoride can help in remineralization, meaning healing of the tooth, especially in its initial stages. So that's why it's important for us to have fluoride in our toothpaste.
And
yes, in our toothpaste. Other than that, now we'll get into areas where you have gum disease, and one of the hallmarks of gum disease is actually, again, sensitivity. So when you've gotten into gum disease or your gum is damaged and you're having sensitivity, then we recommend toothpaste that have desensitizing components such as Sensodyne, which will help block the areas that are exposed that are causing the perception of the pain.
Also, actually, Sensodyne helps in sensitivity to reduce.
Yes, to reduce sensitivity. But I also don't want us to self-diagnose. Let's see the dentist, and then
when in doubt.
Yes.
That's actually should be the theme of this episode. When in doubt, see the dentist. And how often should we now change the toothbrush that we're using?
Very good question. So a good rule of thumb is every 3 months. But you remember what I said, everyone is different in terms of how hard they brush their teeth and how vigorous they are. So you may find your toothbrush in 3 months, it's still the bristles are strict. Intact. But because I'm very vigorous, my bristles within 1 month, they're no longer working. So 3 months is a hard stop. Once it reaches 3 months, make sure you change regardless. But when you see your bristles flaring, meaning they're looking in different directions, yes, please ensure you change.
Okay, questions coming in fast and quick. Dental health is something that actually touches the heart of so many people. It's a very sensitive topic, and I'm glad that you're also doing outreach to the grassroots level. Pale kwa ground, pale kwa community. It's very important because, again, access to these services, it's not always available to everyone. So you guys are doing a good job on that. And one question I'd like to ask you, someone has asked, the back of my tongue smells even after brushing, and it's embarrassing. So what causes this?
So this is a condition we call halitosis. That is bad halitosis, bad breath. So other than just looking at, of course, the obvious factors, we have to rule out all other factors. So when you have gum disease, you'll end up with bad breath. If you have cavities, of course, these are teeth that are decaying, they're rotting, they'll give you halitosis. At times, of course, this is a bit rare when you have candida infection. That's oral thrush, can also give you.
You also have that?
Yes. Yes.
Or, hey, are you serious?
Yes. So,
what about by sharing of toothbrushes, Ama?
No. An overgrowth of candida bacteria in your mouth. Yes. So it's very important for you to visit the dentist so that we can identify what exactly is causing your bad breath. So it's not just enough to brush your teeth.
Yes.
It's good to know how your oral health actually is.
Okay.
So you may be, the same way you said, you're not feeling pain, but I've had a lot of patients who've told me they're not feeling pain and they open their mouths and I'm just seeing cavities and roots.
Don't make me
Doubt
cancel
yourself.
cancel this appointment.
Oh, please don't. So it's important you visit your dentist so
Yes.
that we're able to identify, because if we don't identify the root cause of the bad breath, then we're just putting a band-aid on it. So it's good for us to know what is causing it, treat what is causing the bad breath, and then now give you the correct tools to manage it.
Okay. There's someone who sent in, this feels like a misconception, I don't know. Does it mean that if children don't brush their teeth well, they get to cough? So is this a misconception?
If children don't
Brush their teeth well, that they get to cough. So isn't misconceptions?
I believe so. I
Yeah.
won't know the direct correlation
Right.
of coughing and brushing your teeth.
We come
Yeah.
out of 2 antibiotics because there's there's a flu going around. Probably it's a flu, not oral hygiene issues. Yeah, check on that. Good evening. Ask the dentist, my tongue and teeth are bleeding. What could be the cause? Kindly advise. When in doubt,
Correct.
visit the dentist.
Correct.
Yeah, we can talk about that.
So, bleeding gums are one of the key indicators of gum disease. So, gum disease is brought about by accumulation of dirt in your teeth, especially around the gum area. So, what happens is your gums become irritated by the dirt that is there because they're not able to reach it. So, they swell up and they become red and they become very tender.
Okay.
So, any pressure, even from brushing, can cause them to bleed. Okay. And how we often manage that is by cleaning. The first step would be to clean your teeth, remove the dirt that is irritating the gum, and more often than not, the gum now relaxes and gets back to its normal position and the bleeding reduces. So when you have severe gum disease, we would recommend now you see us a bit more frequently than the every 6 months. And I just to digress a bit again, it's really important, especially when now you have other chronic diseases, because oral health, we have risk factors that are common with other chronic diseases such as diabetes. So when you have gum disease or uncontrolled diabetes, it also makes the bleeding worse because it increases the inflammation. The diabetes makes it hard to control the gum disease because of the uncontrolled sugar levels. So it's important that you take keen interest in your oral health, because it also affects
Your physical health.
Correct.
Really?
Correct. Yes.
Okay, so that's the connection. Okay, we'll never have thought about that.
Yes.
Diabetes in that way. Okay, that makes sense. Oh God, we have a lot of questions. Hello, it's Letty here following your show and learning a lot on oral health. I have a question. Does removal of one molar and one premolar on the same side cause a bent face, and can the disorder be corrected?
Okay. That's a really good question.
Okay.
So when you visit your dentist, we work primarily on two things. We'd like to restore function and restore aesthetics. So function in terms of how you're able to chew without pain properly, and aesthetics, especially when you have cavities in your front teeth, we want you to be able to function, to, of course,
Look good.
correct. So when we remove teeth, especially the teeth that are used in chewing, that's the molars and the premolars, we always recommend you replace them. The reason being is when teeth are held in position by the opposing tooth.
Okay.
So meaning because there's a lower tooth, the upper tooth remains in position, and the teeth interlock in such a way that helps you properly chew. So this interlocking, when it's disturbed, you will of course introduce other challenges. So that's why when you visit a dentist and we remove a tooth, or we notice a tooth that is missing, we will always encourage you to replace it, so that we can reintroduce the stability in your mouth and allow you to function optimally.
Okay, that makes sense. Someone was asking, should we brush after breakfast or before? Daktari said after your meals. But there sometimes you are actually, when you wake up, you just want to remove the bad breath from from the whole night you've slept, and you want to brush the first thing when you wake up. So is this okay, or I also have to again brush after the meals?
So actually, we are keen on even the duration of time between you brushing and eating. Most scholars recommend at least 30 minutes, because we've brushed and we've changed the pH of the mouth. So you may immediately eat something that will cause damage to your teeth. So we don't want you to disrupt that. So if you wake up and brush immediately, we'd want at least 30 minutes to pass before you eat, and then ideally we'd want you to cleanse your teeth one way or another. So if you're able to brush after you eat, that is the most ideal situation.
Okay, well noted. There's one saying, how should I brush while using Sensodyne toothpaste? He is Joseph from Malaba. And from this question, also just plug in how guys who have braces practice oral hygiene, especially when it comes to brushing, when it comes to eating. Yeah, so plug that in.
Correct.
As we wind up.
So we use Sensodyne like any other normal toothpaste. So Sensodyne, as I mentioned, is meant to help reduce sensitivity that you will be experiencing in your teeth. So in the morning, just same pea-sized amount on your toothbrush, brush your teeth as normal for 3 minutes, rinse it out and let it be. So that is the, of course, ideal way of using Sensodyne as you would a regular toothpaste. For brushing your teeth when you have braces, we have specialized tools that we also recommend to our clients who have braces. So we have interdental brushes. We have a special type of brush with of course, again, a soft bristle, just to make sure you're able to reach those hard to reach areas. We have flosses that are specifically made that you can use with braces. And beyond that, we have other adjunct devices, such as a water floss that you can use to just cleanse your teeth, especially in between the braces. So normally when you get your braces, it is essential that your dentist shows you how to properly clean your teeth, because it is one thing for me to just mention, oh, go use an interdental toothbrush, but you get this device and you don't really know how to use it. So I'd recommend, of course, people who are thinking of getting braces or have gotten braces, have this separate conversation with your dentist where we actually help you, show you how to use these devices effectively to maintain your oral hygiene. Beyond that, of course, with braces, it's again really important you maintain your visits as recommended by your dentist. Their visits are normally between 4 to 6 weeks with your clinician, and during that visit your doctor will also check and tell you where you're brushing properly. If you're not brushing properly, adjust your technique to make sure you're doing it appropriately. With braces, again, we're also keen on diet, so that you're not chewing foods that are too hard, that of course would damage the braces in the process. Unfortunately not.
Okay. Thank you so much. Oh my God.
Thank you too.
Please, Sensodyne, we need a couple of a couple more episodes of oral hygiene, because we have a lot, and your questions are coming in fast and quick. We'll also make sure to respond to them on our social media platforms at KTN, and also you will find this episode on YouTube and at KTN on the entertainment side, also at KTN News. You'll find this episode there. And where can they find you when wale kama sisi wa kubook appointment? Where can we find you?
So I work with the Aga Khan Hospital at Valley Arcade. Okay. You can find me there, and you can also find me through the Kenya Dental Association. Just reach out to us. We'd also be happy to partner with other entities so that we can also reach out to more people and talk to them about oral health, and of course make sure that oral health is more accessible to the public.
Thank you so much for coming to the show, for your insights as well. A happy mouth is a happy mind, and as we mark this World Oral Health Day, this has been Health and Wellness. My name is Zaitun Ali. Until next Sunday, 6 p.m. right here on KTN. I'll see you then. Bye-bye.
Health and Wellness brought to you by Sensodyne.
Sensodyne gives you long